Obesity is one of the illnesses with the greatest impact today. It's a very common disease, so it's considered a public health problem. This illness is defined as abnormal or excessive fat accumulation that presents a risk to the health of the people, or in case of the patients.
According to etiology, obesity is the result of an imbalance between daily energy intake and energy expenditure, resulting in excessive weight gains. Obesity is a multifactorial disease caused by genetic, cultural, and social factors. The other causes of obesity include reduced physical activity, insomnia, endocrine disorders, medications, the accessibility and consumption of excess carbohydrates and high sugar foods. Food is the greatest contribution to weight gain. Environment is also what influences our ability to maintain an unhealthy weight. The world around us, not having area parks, sidewalks, and affordable gyms, it makes it hard for people to be physically active. It also affects food advertising that encourage people to buy unhealthy foods, such as fast food.
Now I'm going to talk about the physiopathology of the obesity. As we know, the obesity is a stage of malnutrition by excess that leads to defective immune function. Excess body fat is associated with changes in leukocyte count such as monocyte, lymphocyte, and neutrophil counts, but lower B and T cell mitogen induce proliferation. Most of the studies show that immune dysfunctions involve obesity-associated alterations like inflammation and insulin resistance. Obesity is also referred to as a chronic low-grade inflammations or metabolic inflammation. This illness is called like that because the adipocytes produce proteins called adipokines, which play important roles in inflammations. Obese individuals have adipocyte tissue that mainly secretes pro-inflammatory adipokines, which is not normal because in people that are healthy, they produce anti-inflammatory adipokines.
About the epidemiology of obesity, it is recorded by the World Health Organization that 1 billion people in the world has obesity. It also counts that every country in the world has people with obesity, and in the last decade, instead of declining, it has been up and up the percent. It is estimated that 650 million adults have obesity, 340 million adolescents, and 39 million children have obesity. At this moment, at the record, Kuwait, USA, Saudi Arabia are the top 3 countries that have obesity. Mexico stays in the 14th place of this scale.
Symptoms. Well, the most obviously is that the patients are bigger than they should be, so it's present a weight gain, shortness of breath, fatigue and joint pain in necks and feet, reflux and acidity, swelling, pain and cramps in the legs, and even they present a loss of control to urinate.
The clinical manifestation, the symptoms of obesity go beyond excess body fat. Some are life-threatening and some are common, but doesn't mean that any of them are normal. The common symptoms of obesity in adults is excessive body fat, shortness of breath, sweating more than the usual, snoring, trouble sleeping, skin problems, inability to perform simple physical tasks, fatigue, pain, especially in the back and joints, and psychological issues. In the children, it's almost the same but a little of different. It starts with fatty tissue deposits, stretch marks on the hips, back and legs, shortness of breath with physical activity, sleep apnea, constipation, low self-esteem, and early puberty. Obesity is considered since 30 in the BMI rate, but 40 is already a morbid obesity. The morbid obesity will cause complications such as high blood pressure, which is also known as hypertension, or heart disease because the heart is working harder to pump blood to the body, high cholesterol levels, type 2 diabetes, some types of cancer, asthma, kidney disease, sleep apnea, among others.
Diagnostics includes to make a general physical examinations like measuring your height, checking vital signs as heart rate, blood pressure, and temperature. Also calculate your body mass index, but this is not the best option because it's not very precise. So measure your waist circumference and manage another health problems.
And finally, to treat me, the best way to treat obesity is to eat healthy, reduce calorie diet, and exercise regularly. To this, you should eat a balanced calorie control diet by an expert, such as a dietitian, join a local weight loss or a counseling, because as it was mentioned, this affects on your mental health. Take up activities such as walking, jogging, swimming, or tennis, but it has to be 2.5 to 5 hours a week. And eat slowly to avoid situations when you know you can be tempted to overdose about food. It also exists surgery about weight loss, but this is less recommendable because it is not on the natural way and is more when you need really help to lose weight. This limits the amount of food you're able to comfortably eat or decrease the absorption of food and calories.
In conclusion, we can say about the obesity is one of the most present health problems now. It's such a complex illness that affects in many ways our life. Despite the efforts to make it less in a modern day, every day it gets up and up the count. As it will say, people should be pointed out because of this. Science eats their body and we have to respect them, but everyone as a society should be promised a healthy life, despite vanity and stereotypes. As we searched during all this investigation, the complication of this can cause deadly consequences and a really bad quality in your daily life, not only physical, but also mentally. But paying attention to the treatment and also way to prevent it not only helps your body, but your state of mind as well. So, taking care of your health and body brings more benefits and is much better than all the consequences that this brings to you. So, it's important to be in a constant check with your doctor and be self-aware of your health.